right. And if you joined us a little late, just a quick reminder, if you comment, like, share, you're entered into a drawing. Dr. Aaron and Dr. Boucher are doing 2 30-minute nutritional consultations, and then we're giving away some dynamic greens in code Q10. And so I'm going to continue what Dr. Aaron was talking about. I'm going to talk about recovery. In recovery is not only from injury, but also just day-to-day life. And so we're going to kind of cover a couple different topics. So to maximize your recovery capabilities, for everyone it's different. If you're 80 years old and roll your ankle, the maximum speed you may recover is 6 weeks. If you're 20 years old, college, best shape of your life, really good diet, you may be able to heal much faster than that. So this is all relative to the individual. In all these, as always, all these may not be right for you. Do your own research, check with your doctor before you start any of them. So photobiomodulation or laser therapy, with laser, what it's doing is it's putting light energy into the body. The mitochondria of the body, the cells can absorb it. And so this is increasing the ATP levels in the cells, which ATP is kind of just the energy, kind of coins of the body. It's so kind of the energy credits of the body. DNA production, this leads to healthy cells, more energy. The cells are obviously what makes up everything in the body. So if the healthier your cells are, the more energy to regenerate, the faster you can, speed heal. And so, it'll increase cellular energy, like I said. The laser can also reduce pain, inflammation regulation, and so our bodies need inflammation, but as Dr. Aaron was talking about before, chronic inflammation is an issue. One, we add in a bad diet, drinking soda, chronic stress, this is all going to increase inflammation in our body. So when we injure ourselves, if we already have a ton of inflammation and we're not able to regulate inflammation, that's when it takes longer for tissue to heal. Like I said, accelerated cellular healing, faster wound healing. It stimulates fibroblast development, which are kind of the cross links to close a wound. With laser, we've had a couple really cool cases in here where we've healed diabetic ulcers that haven't been healing for one was over a year, it wasn't healing. A couple were months, and over a period of time, we've got them to close up using the laser therapy. Increases production of the kind of the capabilities of the cells in that area. And also, too, has a improved nerve function, diabetic neuropathies, laser therapy is a good potential for helping with those. So cryotherapy, this is all, this can be icing, but kind of what I'm talking about here is cold immersion. And so, the cold immersion is pretty simple. You can do it a couple different ways. Fill the bathtub, some ice. You can immerse yourself in that. It can be something as simple as taking a cold shower for a minute or two in the morning. Has a benefit on the immune system, increased cell longevity. It decreases the levels of inflammation in the body. It's also kind of a stressor on the body. So stress in the body is a good thing as long as we're not overloading it. And so, what this will do is cold water, your body will constrict the vessels on the outside of your body's arms, legs, and make sure the organs have enough blood. So this will increase the rate the heart has to pump. And so it's kind of a good cardiovascular stressor. Obviously if you're worried about that, you can check before you do it. How you would do this, like I said, you can use cold ice packs for 15 minutes. But like I said, you can do simple shower, end of your shower, just turn it all the way cold for a minute or two. That's a real simple way to do it. Or if you want to immerse yourself, you can do where you fill your tub up. You want to keep it around 50 to 60 degrees Fahrenheit. When you're starting, about 10 to 15 minutes is all you need.
Got a question. I see it says up there it's not good for strength training.
Yes, and so if you're an endurance athlete, say you go run out 10 kilometers, ice tub would be a good idea for you. If you're trying to be a bodybuilder, you go hit the gym for 2 hours, ice bath isn't great for strength training. And so, it's kind of situational if it's right for you or not. But yeah, if you're a strength athlete, you're probably not going to want to take an ice bath afterwards. But if you were an endurance athlete, it'd be better for you.
Quick question on the cold shower stuff. I suffer from migraines, and I do the 1 to 2 minute back and forth a little bit.
Yep.
Is that a good thing to do or not? The situation that I have with migraines and stuff.
and we can definitely talk about that later as well.
Okay, but
So,
it is a good thing?
yeah, I mean, especially, yeah. So,
Okay, thank
vibration therapy is another one. With this vibration, you can do whole body vibration where you're standing kind of on a plate and then it vibrates under you, or you guys have probably seen a lot of those handheld kind of percussion guns. That's similar to vibration therapy. With this, it can increase your strength, power, and speed, depending on the studies you read. For a younger athlete, if they're in good shape, it's going to have less of an effect on them. But if somebody that's aged, sedentary, it's going to have a more effect for them for increasing strength and mobility. Also, too, with ankle stability, a couple studies showed that after 6 weeks of training with ankle stability compared to a Basu ball, which it's like a gym ball except just half of it that you can do. They had some more benefit from the whole body from the vibration therapy. And so recovering from an injury, it's a good tool if you're older or coming off a stretch where you've been immobile. It's a good easy therapy that you can do that had similar benefits to actual strength training.
How often do you have to do it to get results?
And we can ask, just for time's sake, we can cover some of those questions at the end. Usually minimum, you do it, 2-3 times a week. So movement, and Dr. Bouch will probably cover more of this at the end. Like Dr. Aaron was saying, we need to move our tissue to heal our tissue. And so, as I was kind of, getting ready for this talk, I came across, your website. I kind of like the saying, no drugs, no pain. And so I'll talk a little bit about it later, with NSAIDs. But movement, after you've injured yourself and you're trying to recover, we need to move our tissue, but if it's painful, we can be irritating and taking it longer to heal. And so if you sprain your ankle and you start running again, and then the next day it's painful, that ankle is going to take longer to heal. But if we gradually load that tissue, like Dr. Aaron was saying, if we're hurt our wrist and going here to here hurts, but if we can do this, that's still going to be moving that tissue in the direction it needs to be moved. It's going to be giving the brain attention to that area, saying that we need to give resources to the area. It's going to line that tissue up properly as we're moving it so it heals right. If not, if we just cast something, it's going to heal slower, but also too that tissue is not going to heal in the direction it needs to, so it's going to take a lot longer to get fully functional after you recover from an injury. So Kinesio Tape is a tape that's been for a long time. My dad's been using it for, 30 years. That was back when they only had pink and hot, bright blue, so nobody would ever see it. So when he got taped at a game, everybody's like, oh, what is that? And now you see it in the Olympics, you see it everywhere. A couple of things that Kinesio Taping is supposed to do is usually it has a little bit of elastic stretch to it, and so it'll pull that up on the skin a little bit, increase blood flow and lymph flow. We need blood and nutrition to get into the area, also to move that area. That'll help with the healing, but also too, it will reduce the momentum on that muscle, so it kind of limits that joint movement just enough where we're not stressing that tissue, and it'll slow down the speed of that muscle so we're not constantly irritating it. And so in Kinesio Tape, it doesn't seem like it does a lot when you tape somebody, but you can really do some awesome things with it. Just one strip on the knee will make somebody that's miserable walking be able to walk pretty well. And it doesn't seem like it should work as well as it does, but it works awesome. Saunas, infrared sauna. Infrared sauna, near infrared light, same kind of concept as laser. It's all energy, and so so it's similar effects to the laser. Obviously it doesn't penetrate the skin as deep. It may not be as focal as you can get with a laser, but it has a lot of the tissue regeneration properties as a laser. And there's a lot of different health benefits to the laser. I kind of just did a couple, simple ones on. And so 2 20-minute sessions with a 30-minute kind of cool down period in the middle. Increase the growth hormone in the body 2 times. If you increase the heat, for 15 minutes and for that, and then still had the 30-minute cool down, it increases the growth hormone 6-fold in the body. Also too, it'll raise the white blood cell count in the body, helps in the immune system, helps the kind of clear out the damaged tissue in the body, kind of regenerate. And so a lot of awesome benefits of the infrared sauna. Regular kind of your normal heat sauna also has a ton of different benefits to it. If you don't know much of those, those are something to look into just for your daily health and to recovery. As Dr. Aaron was talking about, diet's really important. He covered everything that we need to cover, but just a couple simple reminders. Stick to the outside of the stick to the outside of the aisle in the grocery store. That's where normally we're going to have your fresh produce, meats, everything, anything that's not processed. Healthy fats, oils, healthy olive oils, avocados, coconut oil. Those are going to be more your healthier oils. Anything that you fry in, vegetable oil, canola oil, that's not very healthy. Stick to the organic, grass-fed, meats. You're going to stay away from antibiotics. They're going to be grass-fed, no steroids. Minimal sugar in processed foods. As kind of going back to your question earlier, grains are best to avoid overall for most people. Some people can tolerate them better than others, but even if you don't have celiacs or anything, most of the time it's tough on the body, and so overall they're just better to avoid. Like I said before, minimizing sugar. Most dairy products, some people do better with dairy products than others. A lot of it's pasteurized, which takes a lot of the good stuff out of it. So some hard cheeses, your fermented yogurt, kefir, things like that you may do okay with, and then try to minimal alcohol or no alcohol, especially if you're recovering from an injury. Sleep is a big one, and talk a little bit about this later. And so, sleep is when our body repairs, kind of the dead cells in the body. Every day as we just to live, we are obviously always generating cells. Cells are dying, and so if we're not getting proper sleep, our body's not going to be able to regenerate it like it needs to, and eventually over time we just get that loss, net loss of that cells, and that's when we, are more prone to injuries and also take injuries longer to heal. Also, too, sleep is, obviously to physically recover our body, but also, for our brain, and it's really important. When we're learning, in sports, when we're learning complex movement patterns or just different things, our brain kind of reviews that. It practices in our sleep, tries to rewire the brain, rewire those movements. So if you are an athlete and if you're not getting enough sleep, you're not only doing a disservice to kind of the recovery of your body, but also too the skill part of your game as well. Adults, should get 6 to 8 hours of sleep, more when we're younger. Supplementation, Dr. Aaron talked about that. So, what to avoid? NSAIDs, smoking, poor nutrition, alcohol, lack of sleep, soda, excess stress. Because you can do as much good things as you want, but if you're doing more good than bad, you're gonna have a really hard time healing. So, NSAIDs, yes, they do good at decreasing inflammation, but like I was saying before, we need inflammation to heal. We just need to properly regulate the inflammation. And so, NSAIDs, they increase gut permeability. That's when you will increase overall inflammation in the body. A couple different things I found with NSAIDs. So if you're taking NSAIDs before working out, it increases the muscle damage, it increases liver damage, organ damage. When they had a couple of people take it before races and stuff, they found increased C-reactive protein. That's an inflammatory marker that Dr. Aaron was talking about in a blood test. Cytokines, macrophages, inflammatory proteins, those are just all kind of markers of inflammation, tissue breakdown. NSAIDs block pain, don't remove the cause of pain. Like I was talking about before, we need to move tissue to heal it, but if we're blocking the pain and we're moving that tissue, we can just be constantly irritating it. It may not be painful, but you're not letting that tissue heal. And so, masking it isn't always the best thing to do. Like I was saying, it blocks inflammation, but our body needs inflammation. We need to bring fluid in there. We need to bring blood, platelets, kind of the stuff our body needs to heal. And so if we're blocking that, we can be doing a disservice to our body. We just need to make sure we're regulating it. So smoking, most people know smoking's bad for you. A lot of people probably think, cancer, lung health, things like that. But also, too, it narrows the arteries, so you're reducing the blood and nutritional flow to your muscles, joints, bones. It reduces the oxygen carrying capability of the blood, so it's just less effective. You're not getting that, the oxygen to the area. It decreases the macrophage production. Poor nutrition, we already covered this a few times. Just some, reminders. Calorie is not a calorie. 130 calories from eating a donut isn't the same as eating an avocado. And so, a lot of people, you'll hear, especially with younger people, well, I can eat what I want. I'm young, I'm not gaining any weight. That doesn't necessarily mean you're healthy. So Alcohol will impair muscle recovery and regeneration. You'll get dehydrated. It increases stress hormone cortisol. It decreases growth hormone release by 70%. And so kind of how it does that is, like I was saying before, when we're sleeping, the beginning phases of sleep is when our body's repairing and regenerating. Alcohol really affects that first phase of sleep. And so you're going to miss a lot of that, kind of regenerative process by the body. And so, especially if you're injured, recovering from an injury, try to avoid alcohol. If you have a drink or two, after you're recovered from injury, that's okay. But really, while you're recovering from injuries, try to avoid it. Cover lack of sleep a couple times already. One of the last things is stress. Like I said, low levels of stress that the body can tolerate is beneficial because our body adapts to it, learns how to overcome it. But if we're chronically stressed, we're going to increase cortisol levels. Cortisol's hard on the body. A couple of different studies I found when they were doing this is they took a skin punch, biopsy out of a caregiver of somebody that, caregivers that deal with dementia patients, one of the most stressful jobs in healthcare. And so they compared it to kind of a control group, the people that, were stressed in the job, caregivers of, treating dementia patients. It took their, a quarter longer for their tissue to heal, 24% longer. And so that's, kind of just a, little indicator how chronic stress can damage the body. I think this kind of leads into Dr. Bouch. He's going to talk a little bit more about emotional recovery. He'll talk a little bit about movement, but here he is.